Welcome back to Career Compass, where we interview professionals about their jobs with the goal of learning more about the careers available to us. In this episode, we'll be having a conversation with Miss Shelia Jones, who is a nurse practitioner in DeSoto. So, Miss Jones, how did you get into the job?
Well, I got into this job by my grandmother making me go to nursing school. Fresh out of college, I wasn't really sure what I wanted to do. So I went to the Army, and when I came home, she was like, "What are you going to do with yourself?" And I was like, "Oh, my dear, I don't know. I'll probably do some computers or something." And she was like, "No, you're going to nursing school." And I was like, "Huh? I don't want to be a nurse." And she's like, "Yes, you're going to nursing school." So we came from an era where we listened to what our elders told us, and she saw something in me that I didn't see in myself. So she told me, she said, "Go to LVN school, see if you like it. You'll always have something to fall back on because people always get sick and they die." And I was like, okay. So I found an LVN program here in Sherman. I lived in Arlington. I drove 75 miles every day, one way. And when I started the program, I was like, hey, I actually like this. So I was an LVN for 13 years. And I met my two younger kids' father, and he was like, "What do you want to do with yourself?" And I told him I want to go back and get my RN. So with nursing, you don't have to have a bachelor's degree to go into nursing. There are different avenues that you can take. And to become an RN, you can have a 2-year associate degree. So I went that route and got my 2-year associate degree. And as soon as I was finished with that, I went back and got a bachelor's degree. And then I was like, I want more. I want to be able to be in executive management type positions. And so I got a master's degree in nursing education because I really enjoyed teaching. As a nurse working on the floor, I would precept a lot of the new grads that came out, a lot of the new students, and they enjoyed being with me. But then I was like, I really want more. My dad got sick with cancer, and I wanted to be able to be in the know of everything that was going on with him. I knew, but I didn't know. So I started going to Nurse Practitioner school, and that was a 2-year program. So with that entails about the first half of it is all book work, writing papers, doing research. And then the second half is going to clinicals. So I found we had to do rotations in family medicine, pediatrics, OBGYN, and general health and wellness. And I found out that I enjoyed it. I was like, oh, this is being able to impact people's lives. I can do the teaching part and also, almost being like a doctor. So I was like, okay, let me give this a try. And I enjoyed it. And after I finished school, I said, well, I want to start my own practice. So in 2022, October, that's when I opened my own practice. I moved to the space where I am now back in April of last year, May of last year. So, and here I am.
Okay. Congratulations.
Thank you.
So, can you tell us a little bit about everything that you do? Like maybe an everyday thing,
So, my typical day starts about 8:30, 9 o'clock. I have a schedule of patients that I see. So I'm a family nurse practitioner. So I can see anybody from birth on up until the old age. And people schedule an appointment to see me. And it's more family medicine, preventative medicine. So I do, when patients come in, I do labs on them. I do a full head-to-toe assessment on them. If their blood pressure is high, we talk about ways to reduce blood pressure. If they're overweight, we're talking about ways to reduce their weight, how to eat healthy living, how to incorporate exercise into their diet. And if they come in already with high blood pressure, diabetes, and different things, I manage those, but also try to give them avenues of becoming more healthier. My goal is to get people healthy that are unhealthy, and if you're healthy, to keep you healthy. So you won't go into your 30s, 40s, and 50s as an unhealthy person. So we catch it while you're young, and we keep you on that track. And the goal is coming to the doctor every 3 months, every 6 months, making sure you're getting those checkups, making sure you're having the wellness exams. Because there's so many people in our community and neighborhoods that don't go to the doctor, to the hospital until they're sick or, almost to the point where they're about to die. So, it's more preventative measures. We have standards that we follow. At certain ages, in your life, we have different things that we have to do. So at 40, women should be going for a mammogram. So you should be going seeing your doctor. So at 40, I'm telling you, hey, it's time for your mammogram now. So we detect any type of breast cancers early. At 50, you're supposed to have a colonoscopy, everybody. So we can detect those colon cancers. If there's polyps, they can remove them. At 40, men are supposed to start having prostate exams. So those are those wellness things that, we want that are in place, that are set in place by the government. And we, encourage people to go and get those things done.
Right.
Okay, so you're just all about preventing. Do you do any of like let's say we haven't prevented it, something's gone terribly wrong. Are you doing that as well?
Yes. So I do sick visits if people come in that are sick, flu, cold, stuff like that. Now, if they come in with a broken arm or something like that, we're going straight to the ER, but if they come in, I sprained my knee, sprained my ankle, I can go send them to get an x-ray done. And if it's something that, needs to be fixed immediately, I'll send them to the ER or refer them out to a surgeon that can fix it.
Okay. And walk me through maybe like a typical patient coming in, they've got something wrong. Walk me through from the office work to actually talking to the patient, like the whole process.
So once a patient make an appointment with me, I send them pre-paperwork to fill out. It's a complete health history that gathers their medical information from them, any medical information from their immediate parents, grandparents, siblings. If they're allergic to any medication, they send me their insurance information. So I look at all that, run their insurance information to see what services that they have available and what it will cover and how much the office visit will cover. So the first visit when they come in is normally a complete health history taken. I do a complete history to figure out what's going on with you, what you've had in the past, any surgeries, any concerns that you might have that's going on. And then I send you to get lab work. I do a complete blood count to see if you're anemic, you have any type of infections going on. I do a complete metabolic count, which we call a CMP. That's to check your kidney function, your liver function. I send you also to get a thyroid function study test to make sure that there's nothing going on with your thyroid. You get a hemoglobin A1C, which tells me if you're diabetic, pre-diabetic, approaching diabetes, or if you're great. I also do a fasting lipid panel, which tells me about your cholesterol. That tells me how good or how bad that you're eating. And I do a vitamin D level as well, because Texas is hot. We don't go in the sun. And if your vitamin D is low, you're sluggish, you're tired all the time. So those labs kind of give me an overall picture of what's going on inside your body at that moment. So we normally do those labs about twice a year. And then so I bring them back in a week. In the second week, I do a full head to toe physical. We go over all the labs. If they're diabetic, we talk about how to manage their diabetes. If they need to be referred out to any specialist, I refer them out to any specialist. And I also explain to them everything that's going to happen, everything that's going on. If they need any type of services because I have people that come in that can't afford their medicines. I have reps that send me lots of samples. So if it's something that I can start them on in the office, I go ahead and give it to them. So for instance, if they're diabetic, and the old school way used to be to stick your fingers 4 times a day. Well, now we have these things, Dexcom, Freestyle Libre, where you can put in your arm and it'll monitor your blood sugar for you, and it will alert you if you high or low. So things like that, I set that up for them, show them how to do it. So it's a lot of education, a lot of education. And most of my patients have my phone number. They'll call me, say, hey, I need this. Can you do this? I got this going on. So my goal is to make myself available to my patients in case something is going on, because I want them to feel that connection, to say, hey, she really cares. She's really vested in my health. She's concerned about me. And I generally am. I care about all my patients, and I want them to be healthy and to live long, healthy lives.
So is this like a 24/7 service as
No.
well? No?
No. I'm open Monday through Friday, 9 to 5, Saturdays 9 to 1.
Right.
So when you take certain insurances like Medicare, the government states that you have to be available and have a phone if your patient needs you 24/7. So that's a requirement of the federal government.
Oh, I see.
Yeah, and most of them, you build that connection with, they're going to call you anyway. And because a lot of people tell you, well, I just can't call my doctor like that. They're not available. I have to call the on-call doctor, or call, the after hours, or make an appointment and it's 6 months out. If I have a patient that's really, really sick, I'm going to tell you, come. I'm going to work you in. You might have to sit there, while I see other patients. So, but I also see veterans in my practice as well. Veterans, their schedule, it's a government contract that I have, that are trying to get their disability ratings. And so they come and see me, and I evaluate them, and I send the paperwork back to the government. So I just put my findings. I have no part of that, and they don't come see me as patients. I also do DOT physicals, which is the Department of Transportation, for truck drivers. So they have to have physical either once or twice a year. The government regulates with certain conditions. It's mandated 1-year certificate. If they are healthy, it's 2-year certificate. So you can only get up to a 2-year certificate.
I'd imagine, I know this is kind of a side tangent, but truck drivers, a lot of times they seem pretty unhealthy. Is that true?
It varies.
Yeah.
Okay.
It's either feast or famine. They either are young and healthy or old and unhealthy. Mm-hmm. I just learned the average lifespan of a trucker is 61 years old.
Oh, that's terrible.
My uncle just got into trucking. Let me tell him to.
Yeah.
Well, it went opposite for him though. He kind of like slimmed down, and he started like, I guess he figured out about that stuff, and he kind of slowed down. It's a self-control thing, I guess.
Right, because you're sitting in a truck, you're driving 8, 9, 10 hours a day. A lot of them smoke. A lot of them eat unhealthy at these truck stops. There's lots of unhealthy food and snacks. If you just go into truck stops like Buc-ee's and all the rib sandwiches, the beef sandwiches, and
that's where I'm at.
There's really nothing healthy in there, and they cater to these truck drivers, and there should be more healthy options available to them.
Right.
So, and I told a lot of them to, pack healthy stuff from home. And a lot of them wives will come in with them and they say, oh, I put a cooler and put salads in there, this and that. Well, they're probably throwing it in a trash can or something.
Yeah. I want to touch on something you said earlier. You were saying how patients can call you. And I imagine that's one of the advantages of being at like a small practice, is there's a closer relationship with the professional.
Right. Yeah, I've kind of, a lot of them are family and feel like family. And the business I've gotten has been because word of mouth. And, you know, when you treat people right and you care about them, that will help your profession grow. You grow as a person. You know, I didn't do any marketing or anything. I don't have a social media page for my business. It has grown, you know, just by the way that I treat people.
Right.
That's good. I want to get into, you mentioned it earlier, the education. I didn't know that an associate's could work for nursing. Tell me about each pathway for nursing, and then nurse practitioner as well.
So an LVN is a 1-year certificate program. That's they're right up on the RN, but they're still a nurse. They can do just about everything that the RN can do. They mainly function inside of nursing homes, home health, and those types of setting. There's no prerequisites for that degree. You just take an entrance test and you can get into the program. For an associate degree, that's a junior college 2-year degree. You go and take prerequisites for those degrees is, you know, the English, the math, the science, you know, the core of the that the 2-year degree gives you. But you have to have that anatomy, physiology 1 and 2 and micro. So that's the only thing that's, you know, in an associate degree, you don't have to have that. But for nursing, you have to have that. And once you get into that program, it's normally a 2-year program or an 18-month program. You go, it's very structured. They put you in the classes that you have to take. The very first is fundamentals of nursing. There's skills labs that you have to go to where you get checked off on different skills such as hand washing, putting the NG tubes down, bed baths. You know, you start low and go high. And, you know, after 2 years, you graduate from that program. There's a national test for nursing called the NCLEX. The school sends the stuff to the State Board of Nursing. And they tell you, okay, now you can go sit for the NCLEX test. You go to a Pearson testing center. They fingerprint you. You sit at your computer. You can get up and go take a break. You can't take anything in the room with you. And you sit for the national exam. And if you pass or fail, the State Board of Nursing will notify you.
I wonder, like, at each level, does it get progressively more difficult to study? Is the material more and more advanced?
The material is more and more advanced. But the only thing that's different between a 2-year degree and a 4-year bachelor's degree, in the bachelor's degree, toward the end, it's more management type classes. You know, you learn more about management. It's more community type classes. So it just goes one step further. So you have to have a 4-year degree before you can enroll into a master's program. And there's so many different specializations of a master's program in nursing that you can get. It's unbelievable. There's adult gerontology nurse practitioner. There's family nurse practitioner. There's an acute care nurse practitioner. They work inside of a hospital. The adult gerontology only sees ages 18 and up, I believe, 13 and up. They don't see kids. Whereas I'm family, I see kids. I can see kids. There's pediatric nurse practitioners that only see kids. There's emergency room nurse practitioner where you just work in the emergency room. What else is there? There's psychiatric nurse practitioner where you just focus on psych problems. So, and there's forensic nurse practitioner. There is case management utilization review nurse practitioner. And then there's a master's of science in public health that a lot of nurses get. And that sometimes it can, sometimes it can't fall up on nurses. But there's a couple of schools where it falls up on the nursing as well.
So with the testing, based on your score, is it just strictly pass or fail, or is it you have this score so you can do this, but you can't move up?
It's pass or fail. You either, and the test just tests your ability to be a basic nurse for the NCLEX, for all RNs. Whether you have a 2-year degree or 4-year degree, everybody takes the same test.
Right.
Yes.
And can you, if you do fail, can you retake? Or
yes.
Okay, so you don't have to start over?
Right. You get the opportunity to retest in Texas up to 5 years, I believe. After 5 years, you may have to go back to school.
Yeah.
But nurse practitioner is not the certification that we take. Is not through the Board of Nursing. It's through another entity. But they notified the board that we passed, and Texas give us a license.
Okay, so associates gets you the LVN?
No. The associate gets you a 2-year RN.
Okay.
The certificate is the LVN.
Okay, and then the bachelor's gets you
a 4-year degree, and you still take the RN test. The associate degree and the bachelor's degree is still the same test. You're just getting 2 different degrees.
Oh, so
yes.
You're going to get the same job with the associates
yes.
and the bachelor's.
Yes.
But if you want to go to practitioner, then you have to get the bachelor's.
Yes.
Okay.
And a lot of the hospitals, their magnet status, that's a certification that they get to say, we're going to provide you with the best care from our nurses based on evidence-based practice. You're getting the best care. They're capable of taking care of you. So they're requiring that you have a 4-year degree. Or if you have an associate degree, they say, hey, you have so long to go back to go to school. And once you get that associate degree, you can go back online and complete your bachelor's degree, because there's only a few more prerequisites that you have to do. When I went from my associate degree to my bachelor's degree, it took me 9 months to complete the program.
Okay.
So it's not, you're going back a whole nother 4 years.
Yeah, right. And what's like the difference in the amount of, I guess, practice and knowledge between an RN and the nurse practitioner?
Oh, wow. It's so an RN, you're learning to take care of patients, and you're given direction and orders from a doctor. You still have to critically think and be able to look at someone's labs and say, well, his potassium is high or low. I shouldn't give potassium. I shouldn't do this. But as a nurse practitioner, I have to be able to look and analyze the data to see what medicines I'm going to prescribe, what labs I will need to get, if I'm going to refer him out, send him to the ER, or send him to someone specialized that's outside of my scope of practice. So essentially, I'm not a doctor, but I function independently, almost like a doctor. So I have a supervising physician that oversees me. So if I have any questions, problems, concerns about anything, I'll call her and say, hey, I got this going on with my patient. What do you think? Or I think this. And she'll always tell me, well, what are you thinking? And I say, well, I'm thinking this. And she'll say, well, you're right, but let's add this. So, and there's few occasions that I have to call her. I don't have to call her very often.
Okay.
So, and it comes with the maturity as a nurse. I've been a nurse since 1997. So that's a long time. I've worked in hospitals. So it's all about the amount of experience and the level of comfort that you have as well.
And then what's the difference between the nurse practitioner, what you can do, and how much you know versus the physician?
Oh, it's a lot. They go to school far longer than us. Mm-hmm. Our program is 2 years, and they go to school 4 years, med schools, residency, all that stuff. So it's a lot. They learn a lot more than we do over a longer period of time. Whereas what we're learning is very compact over a 2-year time period. So that's why we have to collaborate with a physician. But I trained under several. So I kind of learned what they learned. They taught me what they know. And as an RN, working in hospitals, we're the eyes and the ears for the physicians. So we've seen a lot, we do a lot, and as you learn and you work with providers, different doctors, you learn, they teach you what they know. So my doctors have taught me what I know. So no, do I have as much education as them? No. Do I profess to be a doctor? No. So we have a scope of practice that we have to practice within. So just like they have a scope of practice that they practice in with their specialties.
Okay.
So it's a big difference. It's a no comparison.
Yeah. Okay.
So, in your job, is there like a specific like part of it that you find difficult, or maybe it could be like like the paperwork, or actually treating someone?
The most difficult part I find about it is getting people to come to appointments and follow up with appointments. Some will come one time and have a lot of problems and don't come back, or they schedule appointments and they miss appointments. So, and that could have been a slot I could have used for someone else.
See, and maybe do you have like a favorite part? You seem like you were really close with your patients. Does that maybe?
That's the most part that I like is, having that connection with my patients, and patients don't feel like, oh, I come in here and get rushed out. During my training, the doctor that trained me, he would always say, I was like, oh, we were in here 45 minutes with that one patient. And he would say, well, they're paying me to be here. And if you were my patient and you had a problem and needed 45 minutes of my time, I would give you that. Because I was his patient, before I trained with him. And I would be like, I've been sitting out there for so long. What's taking you so long? And so he would say, you don't rush patients out because you never know what they're going through. I've had patients to come in, and talking to them, found out they were very depressed. They had things going on in their lives. And, it may have been that point that they needed someone to really, really talk to. So I don't rush my patients out.
I really love that part of like these types of jobs where, you're here for one reason, right? Whether you're a nurse or a cop or a firefighter, but you're here for one reason, but y'all are also there to like support them in more than just what you're specialized in, and
right.
That's like a real great part of like the stuff that y'all guys do. It's great.
Yeah, there's definitely a stronger emotional aspect than something maybe working as
right.
like insurance claims or something
right.
like that,
or a lawyer,
right? Because I've had couples to come in and and to sit down and talk to them, and then they start telling on each other about who's not eating right and who's doing what, and I just be like, okay. So, and then I've had to have hard conversations with couples, and let them know you guys are responsible for each other's health. So if he's unhealthy, it's your fault. If she's unhealthy, it's your fault. You guys have to hold each other accountable and say, hey, it's time to go to your doctor's appointment, or are you taking your medication, or let's eat healthy tonight, or let's go exercise. So
yeah, that's great.
It's not all easy.
Yeah.
But it's enjoyable. I enjoy what I do.
Yeah, and I like that you said about not rushing patients, because I know so many doctors, that I've been to, they'll be like, hey, everything good? Okay, all right, I'm gonna head out. All right, see ya.
Right.
It feels like, whoa, they just came in and left like in like 2 minutes, which in one aspect I understand, because you don't want to be in the lobby waiting forever.
Right.
But in another aspect, it is helpful for them to take as much time as they need, and yeah, that's valuable. Do you have any good stories over the years?
No, not really, really good. about not talking about them because I don't know who's listening to the podcast, and it maybe somebody's life and some, and they be like, "Hey, she's talking about me on here," and then call me like, "Why are you talking to me about those kids?" But the most rewarding part of it is, seeing people go from being. I've had patients to come in that were sick, and hadn't been to a doctor. And they tell you, I was so sick and didn't want to say nothing. You helped me turn things around. You listened to what I had to say. You didn't judge me. You didn't push me up out of here. So that's that's my rewarding story, the good story.
So you said you're open Monday through Friday, or right?
Monday through Friday. After I drop my kids off, and I get my Starbucks, I got to have my fix every morning.
Might get some after this. Right?
Oh, yeah.
So after I drop them off in the breakfast line, I'm normally here by 8 o'clock. I leave at about 4:30, 4:45 because I have to go get them from school. And on Fridays, I'm here till 5. Or if somebody calls and say, hey, I'm running late, I'm getting off work, I need to come see you, I tell them, come on. And Saturdays, I'm here from 9 to 1. And those 9 to 1 appointments, those are normally by appointments only. Sometimes if someone is sick, they'll call and say, hey, are you open? Yeah, I'm open. So
you'd say the work-life balance is pretty good? Right?
I have to make it that way because I used to go home and work. But I have a 9 and 11-year-old, and my 9-year-old, if I sit down at my computer and try to work, it's all about him. Mom. Let me tell you about my day. We talked about that already. Oh, but I forgot something. So I've learned to close the computer at home, not work at home. So to give them my undivided time and attention. Because I have 2 older kids. When I worked in the hospital, I didn't bring work home, so it's not fair that I bring work home now. Unless it's something urgent. Sometimes, I have people call and say, hey, I'm sick, and I'll, okay, I'll send in your prescription. But for the most part, I close the computer.
That's good. Yeah. What when you close the computer, obviously you're making a trade-off. Work there isn't getting done, obviously, because of your kids, which is good. But what are you sacrificing in order to do that? Is it like less? Are you solving fewer patients' problems?
Well, a lot of times it's catching up on charting and submitting claims to insurance. So I try to make sure I do it when I'm here and get it done. And sometimes on Saturdays, I may stay till like 2 or 3 to get some things done and then, go home. So, but Sundays is devoted solely to the kiddos.
Okay.
Yeah. Like that.
Do you... What were you going to say?
Go ahead.
Do you ever get tired or bored of the job?
No, I don't. Because every day is something new and something exciting. Sometimes I see people with the same stuff, but there's that time where, I get to see different things. And I see veterans about 5 or 6 a day. So... I was in the military. We get to talk about some military stuff. So, no, I don't ever get bored with it.
Okay, great.
And are you as passionate about your job? Or, like, you're well, from what we've heard, you're very, very passionate about it.
Oh, I'm very passionate.
Right.
Like, so I have 3 students that are coming for interns. And they have a long list that they have to adhere to when they're here. And even when I worked on the floor as a nurse, I've been a nursing instructor as well. We can laugh and talk, but when we come to taking people's lives, taking care of people, that's a whole totally different atmosphere because you have to be focused on what you're doing. You have to be able to critically think on your feet because if you walk in someone's room and they're blue, I got to start CPR. Or if someone starts to crash and burn on you, you got to use your resources and pull from your mind and say, hey, what am I going to do? Let me get some help, So this is my passion. This is all I know to do since 1997. I wouldn't be able to do anything different if I had to. So I'm very passionate, about this. When my students, when I'm with my students in the hospital, you're a professional at all times. You got to look good at all times. Because if you look good, people are going to be like, oh, they know what they're talking about. If you come in looking any kind of way, no one's going to want you to take care of them. So you got to look good and be professional at all times. That's my first rule, So, and then my second rule is ask questions. If you don't know, no question is a dumb question. Ask a question and, from either me or another nurse, and we'll help you.
That's good to hear that, like, it's a passion and not just, like...
No, it's not just the job.
Not just for the money,
Right. Because if it was just for the money, I wouldn't have opened my own practice.
Right. It's, it's clear from, the moment we walked in, this was, more than just a job to you,
Yeah, there's a closer feeling,
right.
in an office like this. Speaking of the money, though, we have, you ready, Tyson?
I'm ready. I'm going to press it this time.
What kind of spectrum of pay can we expect in this field?
Well, nursing is very lucrative. It is a 6-figure income. So I own my own house. I own my cars. So my kids don't want for anything. And if you talk to my kids, they'll say, my mama's rich. No, I'm not rich. I just work, and provide a comfortable life for my kids.
Yeah, that's all you can ask for. That's all you can ask for, really. Just
Right. And nursing is not something where you just have to be in the hospital taking care of people. There's clinics you can work in. There's dialysis clinics. There's doctor's offices. There's psychiatric hospitals. There's so many different things that you can do, and the income is comfortable and it's great.
Okay, good. That's good to hear, and it makes sense because you're doing so much. You're working with interns, you're working with patients, and so
right.
I feel like that kind of pay is what you should expect doing that.
And
much.
even in the hospital, there's some nurses working in the hospitals that are making $60, $70, $80 an hour. So,
Yeah, I know, traveling nurses, they make a whole lot. Yeah.
They make some good money.
Yeah.
And during COVID, some great money was made out there. So that's when everybody was saying, "No, I want to be a nurse. I want to be a nurse." But, it's not an easy field. I read a study that said obtaining a bachelor's degree in nursing is it's the most hardest degree to get. It is harder than any other degree out there.
Yeah.
So,
sorry, keep going.
Because you have to fight to get into a program. You just can't say, "Oh, I want to go be an engineer and take these engineering courses." So in nursing, you have to take the prerequisites and then apply to get into the programs.
Yeah.
Right. So if you take all the prerequisites and you don't get in, then it was almost like all of your time was just wasted.
No, you just go find another school to get into.
Oh.
There's more than one way to skin a cat than up and down his back. There's so many nursing schools out here. And, I've worked at a couple and worked for one now. And I know the deans of some of these programs. So I told people, hey, come see me. Maybe I can make a phone call and see what's going on. So.
Yeah, my sister's actually going to school for nursing, and she just started her last year. So, but every time she comes home, I see these huge textbooks, and she's not, she takes a break, but she's studying a lot.
Oh yeah, it's a lot of work involved in it. It's not one of those degrees you're just gonna say, "Oh, I'm gonna breeze through this," without studying. You have to study. There's no way you'll be able to get through nursing school without studying. If you don't like studying, it's not. Nah, don't do it.
My mom, she's been a nurse for a while now, and she's just a student. That's what she enjoys it. I'll come home and she'll I'm like, "What are you doing?" She'll have a textbook open.
Yeah, we're learning all the time because things change and more stuff is added. So nursing is lifelong learning. You do not stop learning.
Yeah.
Mm-hmm.
It's real nice.
And I feel like in school, there's unlike other fields, there's really an obligation to learn it all. Because if you're going to be a nurse, you need to know your stuff because you're dealing with
you're dealing with people's lives.
Yeah.
And not only are you dealing with people's lives, you have to deal with families. You have to deal with doctors. There's case managers, there's pharmacists, nursing. You have to have those people skills to be able to interact with everybody.
Mm-hmm. So now we're down to the last couple questions, and this one's unique to nursing. Is it hard to lose patients and see them in pain, and how do you deal with that?
Well, yes, it is hard to see patients in pain and patients die. I've just learned that that's part of life. There's patients that I've gotten attached to families, and you see them pass away, and we're human, we're emotional, and there's been times where they go and we help them transition peacefully and with dignity and respect, and be there for the family and comfort the families. And what's harder is being a nurse and watch friends and family go, to know that what could I have done different, or what else could I have suggested and stuff. But dying is something we all have to do one day, and you can't internalize all of it, and I think that's part of what we're trained to do. Mm-hmm. So there's times you get emotional when you become attached to patients.
So what would you tell someone that is interested in your career?
So what I would tell someone that's interested in nursing is make sure it's your passion before you go follow this dream. Anybody can make good grades and get into a program, but if you're not passionate about helping people, taking care of people, and sometimes putting their needs before yours, this isn't for you. Don't do this because, my mama was a nurse and she wanted me to do this. I have one daughter. I wanted her to be a nurse. Well, she's graduating with a degree in agriculture science. Way totally left of what I'm doing. So, make sure this is something that you want to do. And if you're not sure about it, go and work in a hospital setting, to see if you want to do phlebotomy or CNA. Do something to see what nurses do and make sure this is something that you want to do. And then there's different tests out there that'll help you determine, what career you want to go into. Those kind of placement tests. I don't know if they give those anymore. But yeah, make sure it's something that you want to do, not because this is what everybody else is doing or this is what my mom do, so I want to, she wants me to do this.
Mm-hmm. Although, isn't that what your mom told you?
My grandmother.
Oh, yeah. Your grandmother?
That was different. We came from a different era. I'm 50 years old. You guys are young. Y'all don't listen to parents. We did.
Yeah.
We did. We came from an era where, if your grandparent told you to go do something, you did it. You didn't question it. But I'm glad I listened, because I couldn't see myself doing anything else. But when I went to school, I originally wanted to be a doctor. So, things happen, things change. And so I really didn't know what direction I wanted to go. And, she told me to do what she knew how to do. And if someone asked me, say, well, what should I do with my life? Well, of course I'm going to sell nursing.
Right.
I'm not going to tell you go be a truck driver and I don't know anything about trucks.
Right.
You know about the lifestyle, though.
Right.
It's like maybe was your grandmother? Your grandmother was a nurse as well,
yes,
right?
She was.
Maybe she saw what it required to be one and saw it in you, and helped push you into that direction, which is that's a good thing, right?
Yeah.
Mm-hmm.
Yeah, I definitely think there is value in taking that into consideration, not just being forgetting about everything your parents tell you. Yeah. Well, I think that's everything. You have anything else?
No, that's about it. That's all I have.
Well, thank you so much for letting
thanks
us
for having
talk
me.
to you.
Mm-hmm.
Yeah.
Anytime.
And thank you, everybody, for listening.
All right.
All right. See y'all.